National reports are saying that this year's flu season is one of the highest in the last 15 years, with 2 strains floating around. But just how are those numbers hitting Idaho? What does the situation look like in our neck of the woods? Today, bringing in Dr. Brian Kitamura from Saint Alphonsus to share the latest on this year's flu season. I think a good place to start in terms of comparisons. What makes this year's flu season different than previous years?
Yeah, I think the main thing that we've been noticing is that when people are getting hit with the flu this year, now it's never a pleasant thing to have, but people have been really weak with it. So we've been hearing stories about, people bringing in their kid who's been sick for 3 or 4 days to say he hasn't left bed except to go to the bathroom and get a drink, and people who are elderly and at risk really being, too ill to get up and get around and do their daily activities, and then needing to keep them in the hospital. So it's hitting people really hard. Okay,
so that's important to know, and we know that the next question is, how do I defend against that? I know the science tells us that the vaccine is really our best defense against things about the flu. Is it too late to get one for the season? What would you recommend?
Yeah, no, the best time is now, always, right? If you could have got it yesterday, that would have been better, but we're still seeing plenty of cases of the flu, so it's still circulating around. And even if you had it flu earlier, this year or previous season, the immunity is not necessarily the same from strain to strain. So we always say that ounce of prevention is going to keep you from getting it, or if you get it, you're less likely to have a real severe case of it.
And so many folks will get the vaccine, but there are always folks that also want to take a step beyond that. In terms of guarding yourself, your family against the flu, what other advice would you have? Especially as you said, it's not a great strain out there.
Yeah, no, it's really pretty much the basics, right? So particularly if you're a person at risk, this time of year, avoid crowded places, close indoor activities. If you're going to do that, I know masks can be somewhat obnoxious to wear, but they certainly help you as the end user from getting those droplets in. And then just being real conscientious about being around people that have ill, sicknesses, even if they're minor, and good hand hygiene, of course, always makes sense.
I'm curious, there's always just ideas floating around the community that make it back to the medical circles, and doctors will say, I don't know where that came from, that's not true. Anything floating out there that you think people should know is not true or should know more about?
Yeah, 2 main things that I think people get confused about. The first one is that flu vaccine, that's not going to give you the flu or make you infectious to other people. You should expect to feel a little run down for maybe 12 to 24 hours. That's just your immune system getting ramped up. And the other thing is the influenza that you get that makes you sick that we're talking about. It's not the stomach bug or the stomach flu, that 24 hours of vomiting and diarrhea. It's really more of a total body and respiratory illness, so it makes people feel weak, high fever, short of breath, and coughs. That's the illness that we're really seeing hit the community right now.
I know at schools, at daycares, at preschools, there's a lot of germs, there's a lot of kiddos running around. What advice would you have for parents that really want to keep their kids healthy, and we know that our young ones can be more vulnerable to things like COVID and the flu? Yeah,
the younger you are, it tends to be harder to get. Plus, their immune systems hasn't had a chance to see those viruses over and over, so they seem to get it pretty hard. First thing, of course, when your kids get home, wash their hands, encourage that at home. And then if your child does get sick, if you get them seen by their pediatrician early, sometimes depending on their age, we can get them on antiviral treatments. And then when they're at home, just being real cognizant of making sure that you give them fever-reducing medications, mostly so they feel better and can take enough liquids and stuff to stay up on their hydration.
Okay, and I know that we have some resources and a QR code that I want to throw up. Before we do go to break, though, I wanted to ask, I don't want to give anyone license to not show up to school or work, but I've always heard this idea of if you're sick, if you think you're sick, just stay home, keep it to yourself. Is there medical science behind that?
Yeah, there is pretty good medical science to that, and I think the biggest trick is that people probably don't realize that they're infectious in the early stages of the illness. So the first day somebody has the flu, it may just feel like a sore throat or a runny nose, and they say, hey, I'm just going to tough it out and it'll be fine. And then 48 to 72 hours deep, they really feel terrible and realize they probably took that to work or to school or whatever with them. So it's really a smart investment, if you will. The less people that can get that either at school or in your work, the more productive things are going to be. So we advise people to stay at home until they really know what they're dealing with.
Awesome. Thank you so much for your time, Doctor.
Yeah, absolutely.
We are going to take a real quick break, but again, go get your flu vaccine today. If you could get it yesterday, that'd be good, but I don't know, time travel.
Right.
Science, I don't know. All right, we'll be right back.